Good afternoon. Thank you for joining us for today's webinar, The State of Long-Term Care, Virtual Legislative Update with Senate Majority Leader Kim Ward. I'm Wendy Johnson with the Pennsylvania Healthcare Association. Before we begin, I have a few housekeeping items to cover. PHCA offers monthly webinars to members to receive updates from department staff on regulations, learn from industry experts on current trends and practices, and to gain a better understanding of practical application tools to equip you so that you may continue to provide the highest level of quality care possible. This webinar is being recorded and will be made available on the PHCA website. The webinar has been approved for one continuing education credit for PHCA members. Credits will be uploaded to NAB within the next 2 weeks for those who have provided us with your unique NAB number, and I will be sending attendance certificates as well. A survey will be launched at the close of the webinar. Your feedback is important to us and our speakers, so please take a moment to complete the survey. All attendees will be in listen-only mode. However, throughout the presentation, please feel free to submit your questions using your questions pane on the right hand of your screen, and our presenters will address them at the end of the webinar. Today's webinar is being presented by PHCA's own Director of Advocacy and Government Affairs, Tim Ward, and for an in-depth virtual conversation with Senate Majority Leader Kim Ward. I'll now turn the webinar over to Tim and Senator Ward.
Thank you, Wendy, and thank you, Senator, for joining us. So Senator Ward currently serves, as Wendy mentioned, as the Senate Majority Leader for the Pennsylvania State Senate. She is the first woman in the history of the Pennsylvania legislature to serve as Majority Leader in either chamber of the Pennsylvania General Assembly. In 2008, Leader Ward was the first woman to be elected to serve the 39th Senatorial District and was subsequently re-elected in 2012, 16, and 2020. Leader Ward hails from Westmoreland County, and prior to her election to the State Senate, has served as a Westmoreland County Commissioner and a Hempfield Township Supervisor. And before entering politics, Leader Ward worked as a board-certified respiratory therapist at Allegheny General, Vanderbilt University Hospital, and Hershey Medical Center. In her tenure as State Senate Leader, she's been a staunch supporter and advocate for the long-term care sector, especially throughout the COVID-19 pandemic. Leader Ward, along with the members of her caucus, prioritized long-term care in our hour of need by allocating over $600 million in federal stimulus dollars from the CARES and American Rescue Plan Acts to support nursing homes, personal care homes, and assisted living residences. PHCA recently honored Leader Ward with our Legislative Champion Award to recognize her efforts in supporting long-term care providers, frontline caregivers, and of course, our Pennsylvania seniors. I'm now pleased to introduce a friend and champion of long-term care, Senate Majority Leader Kim Ward. Senator?
Hello, everyone. It's really a pleasure to be here. This is kind of weird for me because I can't see any of you, but I can see Tim here. So I'll just look at his handsome face through this webinar.
Thank you.
Well, we have spent so much time, and you have, and thank you for everything that you have been doing. This pandemic has caused so much stress, and it's been so hard on your industry, on the frontline workers, it's on the families. It's just been really hard. So I do appreciate greatly all of the care that you have given and provided for our family members and our friends. It's been tough, and it's not over, although the numbers are dropping. I get reports every day from some of the hospital systems, and they're dropping. The numbers are dropping. So that's very, very encouraging. We did prioritize the your industry during the budget because it was one of the industries that there was the most need. We continue to work to make sure that we can work with you because what you do is so important and it doesn't go away. It's not like you're important this year, but you're not important next year. You're important every year. So we will work to do that. So that's what we'll be doing legislatively. Our priorities will be to make sure that we still work our way out of this pandemic for our economy, to get people back to work, to make sure that our hospitals and our healthcare facilities are able to care for people without being as strained as they have been. And we're just going to move forward. We're going to trudge forward. It's not always easy. As you know, the governor's budget address you may know, is coming this Tuesday. So we'll see what he'll have to say, but he says a lot of the same thing every year, increase education, tax Marcellus Shell, all of that stuff. And we haven't had words yet that he's going to talk about really much more than that at all, but maybe we'll be surprised. So what happens with that, when the governor does that address, is now the budget season is kicked off. So we will continue to do legislation, of course, but it's all about the budget. And most of the things that we get done, especially if they're more difficult kind of bills, they get done during the budget, because those bills are able to, kind of leverage between the House Republicans and the Democrats. And, we need this bill and we can do this. And that's all the activity. June is a busy, busy time. But up to that point, we'll still, of course, be working to get things done that we're able to. One of the things that we're looking at, we'd like to get done, we don't know if we can, because the governor hasn't been cooperative, is we're looking at election integrity bills. I know that may not have a big effect on you, but it does affect our population in general. Just making sure everybody feels when they go to vote that it's good, it's safe, it counts, there's nothing awry about it. So we're gonna work on those things. Right now, I am knee deep, I should say head deep, in redistricting. And this is really important. A lot of people don't talk about it, but it's every 10 years we do all the districts for the Congress and for the state House and the state Senate. And that's the districts for 10 years. And a lot is determined in that. Each district is a fight with the other side, because everybody's trying to get the upper hand and make sure that we keep the majority. That's what my job is. Senator Costa's job is to try to get into a position where he can take the majority. So it's been going crazy. I haven't been sleeping very well because of it. I get up in the middle of the night and I'm like, oh my God, So this will be over tomorrow. Whatever happens, whatever our final map is, but we get to vote, and that's taken up an awful lot of time. So I don't want to keep talking. I'm here to listen to you. I'd like to get input from you, and of course, answer any questions that I can.
Great. Well, thank you, Senator. And to your point on the districting, and we can probably dive into that later on in this conversation, but as an advocacy association, our task is to advocate and educate the members that local communities send to Harrisburg. So obviously, as those lines change and potentially different members or new members come to Harrisburg, of course, that makes it even more important for associations like ours to go up there and educate and brief members of the General Assembly on what our issues are, what we're seeing on the front lines, and how we can help our community. So it's a really good point, and looking forward to those district lines finally being solidified tomorrow, so that you can hopefully enjoy your weekend and get a good night's rest, and hopefully enjoy time with family. So, but to kick off and piggybacking off of the fact that we are an advocacy association, our number one job is to advocate for long-term care and educate lawmakers on long-term care. PHCA has a robust 2022 legislative agenda. Can you talk a little bit about the impacts of grassroots advocacy and the role it plays in successfully achieving the enactment of policy objectives? And perhaps maybe you could also provide insight on the impacts of grassroots advocacy from the perspective of your role as a state senator, but also as your position as the majority leader. So just wanted to get your sense on what advocacy strategies you find most effective to you and to your colleagues.
So I think when you visit your legislators and they look you in the face, and you're able to talk to them and explain, when I have meetings with people that are advocating, if I can see when they come into my office and they can show me on their charts and I can see exactly what their issue is. Now they're here because now they're here, and I've seen it. And that doesn't stop. I mean, you can't have a meeting and then walk out and that's the end of it. You gotta stay in touch, do phone calls. One thing that doesn't help is if we get blasted with a phone bank. That doesn't help, to call our office with 1,000 calls, because all it does is tie up our staff.
Right.
It make us mad because we can't get our work done. We can't answer our phone for the people that are calling in for help. It also doesn't help when we get blast emails. If I see an email and I read a few of them and I see that 4 or 5 are exactly the same, I just delete them, because that's just, they ask somebody to push a button.
Yep.
So when you feel strongly about an issue when you know something needs to be done, you need to go see your legislator, set up an appointment, call their office. If you can't talk to them, talk to their chief of staff, talk to their ledge director. Make sure that they have a relationship with you, and bring examples of why what you're asking for is important. And that's how you get champions in the legislature, by one-on-one connections with your legislators, because we're here for you, but there's so much going on that we can't know everything from every issue. So we need to hear from you.
Yeah. No, you raise a really good point, and PHCA, we certainly encourage our members, we lead our members, whether it be right now over the last 2 years, it's frankly been a lot of these virtual visits, which I think actually works out pretty well. It's not as, we'd rather be in person, we'd rather, look each member of the General Assembly eye to eye, shake their hands. But I think these types of advocacy initiatives, taking the time to set up a phone call, to do a Zoom, visit if possible, invite lawmakers to facilities to meet staff and actually see the work you're doing day to day. Those are the types of advocacy strategies I think you would probably agree that are most efficient, especially, as we try and dig out of the pandemic and what we need for right now as we respond to COVID-19, but also what we're going to need in the future as we try and strengthen the continuum and learn from sort of the areas of harm that have occurred over the last 2.5 to 3 years. So with that, I did want to dive into, you mentioned at the top of our show here that the governor is set to deliver his 8th and final state budget address next Tuesday, February the 8th. And it does officially kick off the 2022 state budget process. And rather than dig into the spending priorities of the governor, we really wanted to ask you what your priorities are, what the priorities of the Republican caucus are. So maybe we can start there and just determine or hear from you a couple of main priorities of the Senate Republicans this budget cycle.
So, you are hearing out there that we're sitting on $5 billion or $8 billion. We're not. We're sitting on just a little bit under 2.2 billion. That money, that 5 billion may be there, but it's been allocated. It's appropriated. It's already been appropriated. It just hasn't been allocated. So we really don't have that kind of money. And there's, I keep reading about it, I'm like, no, we don't have that. Stop saying that. So because last year we did, we went through the budget and we allocated for this year in some issues. So when we get moving, we're going to most likely, and it's not my decision, it's a whole Senate decision, and for my part, it's a whole caucus decision to keep trying to help organizations out of the mess that they're in because of COVID. I mean, that's what we have the money for. We're not looking to fill the rainy day fund or, spend it on new spending items that are one-time spends. We're looking like, what can we do with that money that helps? And it's an effect. I don't want to sound like President George Bush, but it's a trickle down, right? Yeah, you fix what you can, and right under it, those things get fixed. And so that's what we will be focusing on. And we haven't talked yet. The appropriation hearings start, I think, next week.
Yep.
Or the week after. And at that point, we'll hear more. We have some things that are always an issue. Every single year, education's an issue, right? Every single year. And that always comes down to like a fight. And the last bit of the deal is education spending. Transportation's always a fight. We need more transportation dollars. We need, so those two are loud. Those two interest groups, they're very loud.
Right.
So yeah. So, we'll be working on that, but we have so much more. Look what you do. We need to help. We need to make sure that we're helping long-term care, nursing homes. We need to make sure we're helping home care. We need to help everybody that has been really working these front lines under great stress. I said last week, and it's true, that a lot of these frontline workers in the last 2 years have been holding our family's hand while they died because we couldn't. They wouldn't let us in the room. And there's a real toll on those workers, a real physical and psychological toll, and it's hard. So I think we need to make them know that they're as important as they are, and because we need them. We need them. We can't function. Our family members that need help, our elderly, our disabled, nobody can get help if we don't have them. So to me, they're a priority, period.
Certainly, and we appreciate that. And to your point, there is this perception, we've seen through media reports that the Commonwealth is, there's that $5 billion of unspent ARP funding, along with, recent income and sales tax collections are ahead of schedule. So there is a perception that the Commonwealth is flush with cash this year. But I know you and your colleagues are focused on, certainly that's not the case, but also looking down, not just looking at 2022, but when we start to look at 2023 and 4 and 5, the picture isn't as rosy, and certainly that we have to be prepared or save now so that we don't have to raise taxes in the future. So along those lines, and I think, again, you mentioned it in your opening remarks, we know, so the governor is going to speak to the General Assembly on Tuesday. Haven't really heard, starting to get some indications through the media as to what he may propose again. To your point, we know education is going to be another major priority. It's been a priority every year of his administration to send more to basic education. Proposals such as raising the minimum wage, taxing natural gas, kind of the greatest hits that he's rolled out the previous 7 years. Have you had any other clues as to where this might lead? Any new programs, or do you just expect this to be a same as always type of speech? Or is there a possibility that there could be some bipartisan agreement on some of what he proposes?
Well, we haven't heard that he's going to propose anything new, but he might.
Yeah.
He may do that. He may come up with something we haven't heard before, and we'll have to evaluate it at that point, whether it's something we can work with or not. We've been talking about minimum wage. But right now, nobody's starting at the actual minimum wage. Nobody is.
You're right. We like to say here that if you're paying $7.25 an hour, there's no way your business is functional. I mean, we've seen it from our providers, both the skilled nursing and the ALPC side. We've had to raise our wages to the extent that we can to compete with some of these big box stores who are out there. I mean, there's wage inflation, right? There's McDonald's is now doing $20 an hour, and there's sign-on bonuses, et cetera, et cetera. To your point, $15 an hour minimum wage sounds great, but I think the market has already corrected itself, and it's already there.
It is. It has. But some people, it's a sticking point because we are so low, one of the 5 lowest in the country. I always like to say we should at least be as high as West Virginia. I mean, seriously, folks. But that conversation continues. But it's already nobody's working for that. Nobody is. I think, wasn't McDonald's or Walmart already at $15 an hour? 15.
Yeah, I think they recently, or not recently, but I think prior to the pandemic, or maybe during the pandemic, they announced that they were bumping everybody up to 15. But I see it. I mean, when I travel down the turnpike, I'm from southeastern Pennsylvania, so when I drive down the turnpike and I'm going into a Wawa, I mean, I was shocked and amazed to see that Wawa was starting folks at $17 or $18 an hour, a $500 sign-on bonus, a vaccine bonus, and then a free shorty hoagie to boot. So, it's truly, employers have had to adapt to attract workers, and we're seeing that in our sector, certainly as this workforce crisis persists. But I think, to your point, the $15 minimum wage, not to dismiss the policy proposal in general, but I just think that we're already paying at least 15 or in and around that ballpark, and that's what we're going to continue to do what we can to attract employees. So perhaps that policy once again is just going to be glossed over again this year.
So are you having the same problem as the hospitals were having? Because they contacted us numerous times with those outside groups are hiring away their nurses.
Yeah, I think you probably will see.
So much money, they can't afford it.
if you could see our members, about 50 of which are on this call right now, their ears probably just shot up because to your point, that is aside from budget, and we can get back to that budget conversation in a minute, but besides from budget, the problems that we are having with price gouging from staffing agencies, it is exacerbating the long-term care continuum, the entire healthcare continuum of the Commonwealth. We are seeing staff leaving our buildings with the promise of these exorbitant wages, upwards of 400% over the average minimum wage for, say, a certified nurse, say the real, the frontline worker in skilled nursing facilities. And, maybe on Thursday they're leaving the nursing facility, and then on Friday they're back in the same nursing facility, but signed up with a contract nursing organization who is then charging the provider upwards of 400% of what they were just paying them yesterday. And it's ludicrous. And even more alarming is the fact that what we're learning is that at least 40% of those contract wages. So if a CNA is if they're promising a CNA $75 an hour, at least 40% of those wages aren't actually going into the pockets of the CNA. It's actually going back to the staffing agency. So, it certainly is an extraordinary issue that we have been dealing with. And we do have legislation that is been introduced in the House from your Western Pennsylvania colleague, Representative Tim Bonner. And we're beginning our advocacy push in the House Health Committee to start educating members on the issue and see if we can't get that legislation rolling. But to your point, it is, one of the biggest issues that providers across the continuum are facing today.
It is. I thought that Senator Judy Ward had something she was working on in the Senate, but I love the term you use. I've been using it. It's predatory. It shouldn't even be. I mean, how is it legal? I guess it is legal, but it's predatory. It's predatory. It's hurting. It's hurting people. It's hurting
and by the way, this is obviously we're going the legislative route, but we have tried. We've gone to the Attorney General's office about it. This is not just a Pennsylvania problem. This is a nationwide problem. We are seeing in Congress right now, there actually last week was a letter sent to the White House asking the president to instruct an investigation into staffing agencies and price gouging. Over 200 members of Congress, bipartisan, over half of the Pennsylvania congressional delegation, bipartisan, signed on to that letter. Our national association, the American Healthcare Association, has sent letters to the Federal Trade Commission asking them to investigate. There's been congressional hearings as recent as yesterday on this subject. So we've been really sounding the alarm and trying to find ways to tackle this issue, because in Pennsylvania right now, you can pop up a staffing agency and there is no regulatory or statutory oversight right now from state government. And we like to say, and I believe we are one of the, if not the most regulated sector in the nation. And here we are having staffing agencies that have no regulation whatsoever, which means we have no recourse. When we see predatory tactics, we have no one to go to and say, hey, you need to take a look at this agency. They're really being aggressive. They're really being unfair to providers. And certainly the end compromise or the end result is it's certainly impacting providers' ability to deliver care. And in time of a pandemic, these folks are certainly taking advantage. So we look forward to working on that legislation in the House, and to the extent that we can get something moving in the Senate, we will be doing that as well.
Is Representative Bonner's legislation about regulation?
So he does. The legislation itself would require the Department of Health to establish a registration process so that we can start bringing these staffing agencies out of the darkness. Because right now, I don't think that the Department of Health truly has a clue as to who they are, who they are as operators, how many of them there are, and who they're working with. So there is an oversight and regulatory piece of this, and then there's also a component that does it would put some price controls on maximum rates that agencies can pass back over to providers, taking into account the average wage rates for your CNAs, your RNs, your LPNs, your direct care workers. And there's also a component to break that out by region, because we know that the wages in southeastern Pennsylvania aren't going to be the same in northeastern Pennsylvania. And so that's really the heart of the legislation, is to start pulling back some control over these folks, because right now there's no oversight and they are just running right over us. And it's interesting, I've heard from lawmakers who've said, well, the continuum should get together and just stop doing business with staffing agencies. And my retort is, well, unfortunately, we're not like another, industry in the Commonwealth where we have to have employees. We are a 24/7, 365 operation. We cannot just say we're not going to do business with those folks, because ultimately speaking, we need the staff. We need the staff to stay open, to continue to administer care. Otherwise, you're going to start seeing, we're already seeing, access to care challenges that are going to continue to persist and grow if we don't have staff. So that's the makeup of that legislation. And certainly, again, we know we're gearing up to have a pretty robust legislative strategy to get this moving in the General Assembly. So I wanted to get back to the budget, and we referenced the American Rescue Plan. And again, I think we've heard loud and clear that $5 billion remaining really isn't, it's already been allocated mostly, and it's not like we're sitting on billions of dollars of cash to dole out for new programs. But yesterday, I wanted to get your reaction to the governor's proposal to spend $1.7 billion, $250 million of which would actually go to long-term care, workforce development and retention programs. I wanted to get your initial reaction as to whether or not you had any thoughts on that proposal, or if likely that's going to possibly go to the wayside and we'll focus specifically on the state budget.
Well, I haven't really looked at that proposal. I just got back yesterday. My brother died unexpectedly last weekend.
Oh, I'm so sorry.
That's okay. It was not very good. But I just got back yesterday, and I haven't seen it yet, to tell you the truth. So, anything he does, we're happy to look at. If there's some good stuff in there, maybe we implement it, but I doubt that if we have just a little under 2.2 billion, if we're going to take 1.7 billion of it and say, okay, here you go, Gov.
Yeah, no, it's sort of, to your point, we obviously appreciate the administration. We frankly, on December 1st, sent a letter to the administration asking for $200 million for all long-term care, part-time and full-time employees to really stop the bleeding, just to do one-time retention bonuses. And that ask was not to the General Assembly. It was to utilize federal, whether it be ARP or CDC funds under the governor's purview, to release $200 million to those types of programs. So we're happy to see that our idea has come to fruition with the administration. Of course, it'll be under consideration with the General Assembly, but any opportunity for long-term care retention workforce initiatives is certainly something that we'll continue to advocate for, both in the immediate and then in the long term. So thank you for your take on that. But the next question I wanted to dive in on is, obviously we've been proud to work with you and the Republican caucus in the Senate and your colleagues in the State House to achieve funding for nursing homes, assisted living providers, personal care homes throughout the pandemic. And as our providers, their frontline workers and Pennsylvania seniors look to the future, our main focus in 2022 is achieving sustainability in the industry. And when we talk about sustainability, it's through Medicaid, it's through investment in Medicaid rates for nursing homes. And as I know you're well aware, over 70% of Pennsylvanians in nursing facilities rely on Medicaid funding. And so our question to you is there any appetite for considering Medicaid as a program for some new spending, some recurring spending in this budget year, or are we looking again for one-time funding?
So if it's recurring, it would depend on what the cost is, recurring wise. I mean, we have put some recurring things in place that, we keep saying we don't want to have recurring spending, but we are working on recurring spending for one of the EITC programs, for example. So it would depend on what it is and if we think we can maintain it, because that's the important part of it. Is it manageable when we don't have this little pile of money here? I mean, it's definitely something we should look at, because I mean, you guys have to survive, because we need you. So,
Certainly. Yeah, and just to I'm sure you'll be hearing from our organization along with other long-term care organizations over the next several months leading up to June 30th. But just to give you an idea as to what we're looking at, certainly that sustainability factor, and really breaking it out into 3 separate buckets, including some operational costs to deliver care. We haven't seen a substantial Medicaid increase since 2014. Frankly, the governor in his 8 years, or 7 years, I should say, we'll see what Tuesday holds, but in his 7 years as governor has not proposed any type of increase in Medicaid for nursing facilities. So we'll be looking at operational costs to help make us whole from the 7 years of underfunding, but also account for some of the new operational costs due to the pandemic. Also looking at funding to increase wages for our frontline caregivers to make us more competitive in that wage market that is continually being inflated as the staffing shortage persists. And then also, we'll be looking at funding to increase the capacity of long-term care workers to the tune of, possibly hiring an additional 1,800 workers to the bedside. So that's really where our focus is in 2022 with the state budget, obviously exploring additional avenues through American Rescue Plan funding if available. But we appreciate, of course, your candor there, and obviously we will be, meeting with you, your colleagues, and this is where advocacy comes into play, because it's our job to go out there and tell it.
Good point. That's a good connection right there. Yeah.
So moving away from budget, there are, of course, other legislative priorities that we have, and of course that your caucus has. And so we're 5 months or 5 weeks into 2022. Lord, it does seem like 5 months. And just curious, as the workforce crisis is being felt across all industries of the Commonwealth, the long-term care sector continues to be decimated. As the state Senate, is there any packages to address workforce issues on the horizon, and not just addressing long-term care, but are there any bills that you're interested in moving in the immediate to address the workforce challenges?
I'm not aware of every bill that's in the Senate, of course, put out, but jobs and the economy are, the top of the schedule this year. So we'll have to look and see if there are. We're happy to do that. Training is good. We're looking at maybe some loan forgiveness stuff, some things that help workers. I don't have a big answer for that, but workforce development is always there.
Yeah.
It's always like there's certain things that are always in the background, right, in your legislature. There's workforce development, there's education, there are regulations. People are always saying, we got to get rid of these regulations. There are certain things that are always there, tugging at you, that you want to try to help. One of the things that is constant, and I think actually Senator Allman has a bill this year, is lowering the corporate net income tax. I mean, we need to lower that. You know how many jobs we lose and businesses we lose in Pennsylvania every year because those companies take off for Florida and Texas mainly, and we lose them. So we were thinking maybe this is a good time, because it costs a little bit of money to start it. It takes a little bit of time. It's an upfront investment, but thinking a couple years down the road, we've now have more people in the workplace, and more jobs and more companies here. So when we talk in a broader sense, we have those kind of ideas in mind that would help with jobs. Specific to job training, I don't.
Yeah.
I don't.
Yeah.
If you have an idea that you'd like to push forward, please give it to me.
Well, I'll do you one better. I mean, I think that your colleagues in the state Senate, certainly the Republican majorities in both chambers, and of course your Democratic colleagues in general, you know, over the last year, we've been very happy to see that some of those workforce initiatives that we've had have gone through the legislative process, have passed with overwhelming, if not unanimous, majorities, and have made its way to the governor where he signed. A good example is the legislation that passed one of the last days of session in 2021, certified nurse aides. It's 120 hours of in-person training. You look at how this workforce has evolved, and most people have spent their the pandemic working from home, doing online education. Well, of course, frontline caregivers cannot do that. They have to be at the bedside. But when we look at training them, are there ways that we can make it a little bit more flexible for the frontline caregiver to train online, at home, utilizing their own schedule, and that making it a little bit more easier to become a healthcare professional, but also more attractive, having that flexibility to possibly work full time during the day and then train at night. And Senator Judy Ward sponsored that legislation, and the Senate promptly kicked it right out, and we got the House to pass it, I think December 16th. And it's signed into law, and it should hopefully get up and running in the next several weeks. So those are the types of bills that we've been working on, we've been advocating for, and the General Assembly, yes, the General Assembly has, yes.
So moving forward, what else do we need? You asked me if we had anything we were looking at.
Yeah, so we're looking at legislation that I believe is now awaiting action in committee from Representative Brett Miller about international nurse programs. There's legislation that would allow those who trained internationally, who accredited institutions who have similar curriculum to what's expected of Commonwealth RNs. That legislation would allow those nurses to immediately sit for the RN exam in Pennsylvania and then get them to the workforce immediately. So that's something that we're looking at. We're developing
a bill like that, Tim. We moved a bill like that out of the Senate in January.
Okay, well, I will. I'll take a look for that. I know I was tracking the Miller bill, but if there's an opportunity, of course, that bill maybe a Senate companion moved out, we'll take a look and make sure that we're advocating to our House folks to get that done as well. So those are the types of things that we're looking at to support workforce. Obviously, that agency bill. The one benefit of that agency bill is it might help stem the tide of folks leaving our facilities going to work for agency. If we start doing some more regulatory components of that, that might bring people back to our buildings, and that certainly helps our workforce. So those are the types of concepts. Yep.
We got to get on that, and I'm glad we talked about it today. And that's Representative Bonner's bill, right? Now I have to see what Senator Judy Ward's bill is, but that's important because it has been just. I've been walking around for a couple of months saying, how is this legal? How can they do this?
Yeah.
So we can change it from regulation. And I don't blame those workers. I mean, if I'm going to go make, 3 times or 4 times as much, okay. So
certainly. Yeah, you're exactly right. It's certainly, we can't blame the worker for obviously trying to increase their financial stake for their family. That is obviously not our intent to harm the worker, but just based off of the evidence that we've seen that a lot of those extra wages are going into the pockets of corporations and not truly being passed down to the professional, that's where we think that government has a role to step in and say, hey, this has to stop. So from a workforce perspective, that's what we're looking at. And then I wanted to quickly move over to another one of our legislative priorities that is kind of we've taken a run at in the past, and the Senate has been very helpful with, is tort reform, specifically COVID-19 liability. And I know I'm preaching to the choir. We got that bill to the governor's desk ultimately for it to be vetoed. And I just wanted to get your take on efforts, whether it be COVID liability or just general tort efforts. Is there any opportunity this year, or are we truly waiting to see the outcome of the governor's race, and maybe we'll get a governor who is a little bit more favorable to some of the reforms that we've been looking at? Any thoughts on that?
I'm pretty sure the Attorney General was going after the nursing homes here in Pennsylvania, right? Is that correct?
So there's been some investigations, of course. We've had conversations with the Attorney General Shapiro about that, and we'll continue, obviously, as he's the presumptive nominee for governor on the Democratic side. But to your point, we know that any tort effort that we try and move will ultimately be vetoed by this governor. So, we have a pretty robust plan in place for 2022 to interview the candidates for governor, and not only on tort issues, not only to get their positions and their perspective on tort issues, but across the entire spectrum of long-term care. But I think this also proves why engagement in the 2022 elections are extraordinarily important for every member of this organization, because we truly have to make sure that we're sending leaders from the top down to Harrisburg and to Washington who are going to have our backs. And certainly, this is the year to make sure that we're engaged.
I agree. If anything, this pandemic has proven how important it is that you have the right people in place every day. But this is a shot. I mean, really, we have a spotlight on what happens, right? You have a spotlight on what happens when you get a governor, whoever your governor is. You don't just get a governor. You get all those appointments, all those secretaries that do regulations, right? That look over the nursing homes, that do, your electric bills. I mean, you have more than just a governor. You have everybody around a governor. And I just love that you said that, because it's important that everybody know and they vote how they think they need to vote, but they should be very well informed about who each person is and know exactly what they're getting. Because so many times, I mean, you get a presidential year and there's so much turnout, you can't keep your poll door. You can't even get them all on the polls. But this year it'll be a little bigger than just an off year, but it won't be as big as it needs to be.
Exactly.
It's important. Your vote counts. Every single vote counts.
Yeah, and along those lines, and I of course don't want to stray too much into the political fray, but we were talking about lines, and we know that you're going to vote tomorrow on the state House and state Senate lines. I saw yesterday, can you talk a little bit about the status of congressional lines? It seems to me that the state Supreme Court has now taken over the process of selecting, I guess, one of 13 maps, perhaps, that I know your caucus has submitted a few. Each of the caucuses has submitted, the governor submitted. Any update or any overall viewpoint on where that's going to land?
We have not heard anything. I mean, we know what you know. As you know what happened, the governor had his own group of people out doing a listening tour. And then he drew a couple maps. And so we got his maps. We tried to work with the other side of the aisle on some of them. I mean, they didn't love those maps either, but we were trying to work something out. And then they called us on Sunday night before we had to get this done by, I think it was last Monday. At 5 o'clock. And they said, we're out. So if you can't come together as a legislature and make sure you have enough votes for a map that is going to override a veto, you're done. Because if the governor said, I'm going to veto them, if they're not my maps, I'm going to veto them. So we're done. So it's in the court's hands. And I don't like it, because it's really our job to do that.
Yep. One of the potential, I guess, outcomes of the courts taking over the map making process and things still being in flux is the potential to move or the need to move back the Pennsylvania primary, which is scheduled for I believe the second Tuesday or third Tuesday in May. Have you heard, is the General Assembly looking at that, or is that something that the courts might step in and do?
Well, as of right now, we don't need to do that. So the maps will be voted on tomorrow, and then they have a month. There's a month for people to challenge them, and I'm sure they will challenge them. We have an opportunity to shorten the time period between petition filing and the actual primary. Some really want to move the primary. It costs the counties money to do that. It's not as simple as, it's a last resort to me. It's a last resort. If we have to, we have to, but I'd only be good for moving it a week or so. We don't, because so far, I mean, we were late. It took us a longer time to get our maps together because the federal government was late, right? The census didn't get in here until September, end of September. and we were supposed to have it in the spring. So we've been moving quickly. And at this point, if everything goes smoothly, we might still be okay. But, every day that we don't vote on a map, it gets a little bit less likely that it will be okay. But tomorrow, it's it. We're done, I hope. Please, God.
Got it. And then I guess the final question before we open it up to questions, and just in general, without getting into any specific candidates, but we have a pretty robust field on Republican and Democratic side for U.S. Senate, and then primarily on the Republican side, as I mentioned, A.G. Shapiro looks like the presumptive nominee. What qualities are you looking for when you're evaluating, just as a Pennsylvanian, but also as the Senate Majority Leader, in terms of a partner in the executive branch for governor, but also for U.S. Senate? What qualities are you looking for when you're evaluating these candidates? Because ultimately speaking, the petition process is going to start. We're going to start seeing the campaign ads, and it's going to be up to each and every one of us to start evaluating these candidates. But curious of what your thoughts are thus far on both races, and if you're looking for anything in particular from candidates.
So the Democrats easy because there's only Josh Shapiro, and I don't think that's healthy. Because when you don't have any kind of primary for an office this important, that person never has to take a stand.
Yeah.
Never have to take a stand, so you don't really know where they are. And as far as I would like to see a candidate, number one, I'm a Republican, so I'm going to speak, they can win. Like, do we have someone who has what it takes to win the race? We don't have, can they attract voters that we don't usually get? Can they get voters with their agenda excited enough to make sure they want to go out and vote or want to go out and help this person win? It'll be an uphill battle. They don't have you look at some candidates and, it's hard from the legislature. That doesn't mean that those that are in the legislature wouldn't be great governors, because we have some good candidates from the Senate up. It's harder because people attack your record. They can pick one vote out and make it like you were the devil. So it's tougher. So, and somebody that is going to be able to raise the money, you have to have money. I mean, I know that sounds horrible, but you have to have the money to run. I think whoever the Republican candidate is, or the Democrat candidate on both sides, the money flows there. It will flow there after a primary. So we're just looking for, a good conservative that won't sign, will help us pull us out of Reggie if the governor somehow gets us into that regional green gas house initiative. We need somebody that's going to pull us out of that. It's not good for Pennsylvania. We're a huge energy producer, and the only producer with this great amount of natural resources in that group of states. So that's important to me. Like, where do you stand on that issue? Or we don't want anybody that's going to come in there and raise everybody's taxes. We don't want that. Nobody wants that. But we need a governor that'll be aggressive in recruiting businesses here and cutting regulation. We don't need any of these regulatory agencies to make it harder for somebody to get a permit. It should be simple. A lot of states, it's simple. Pennsylvania is not so much. So that I'm looking for that type of person who will cut the red tape from the top, not put us further in debt, and will protect our natural resources.
Great. Appreciate your feedback there. I think, it's certainly going to be an interesting contest from the gubernatorial perspective. And of course, we do have a U.S. Senate race that there's a lot more competition on the Democratic side, plus you have the actual competition on the Republican side. So that'll be interesting. But then to your point, as it really impacts your position and truly us locally here in Pennsylvania, the governor's race is going to be the premier race as we come down the stretch here. So I encourage everyone on the call today, if you haven't done so already, start reading up on some of these candidates, because there's a lot of them, especially on the Republican side, and they all come from different backgrounds, all have different points of view on some of these more important topics, including preserving healthcare and long-term care. So encourage everyone to take a look at or start doing your research, because the primaries are coming. So with that, I wanted to ask Wendy, do we have any questions for the leader?
We don't have any questions, but we are open to questions. So if you do have any questions, please type them in the question pane on the right hand of your screen, and we'll get to them here momentarily.
I have just about 10 minutes because I have another Zoom call.
Sure.
So just so you know, I have
Yeah,
time
not
for
a problem.
one or two, and that's probably it.
Yep. No, if we're open to questions. If there aren't any, we'll give you some time back in your busy calendar today, leader. So we'll just give it another minute or two here to see if anybody wants to chime in and ask. Now's the time. We have arguably the most powerful person in the General Assembly right in front of us. So if we have any questions.
Yeah, it's been a great
That's a little
conversation
much.
today.
That's a little
Thank
much
you.
there.
All right, I don't see any questions, so I think we're going to give everybody a little bit of time back in their day. And again, just a reminder to stay on to complete the survey as you're logging off today. Today's webinar is being recorded and will be made available on the PHCA website. So if you know anyone who may have missed it and may benefit from the conversation, please pass that along. I'll have it up by tomorrow on the website. Again, we want to thank you, Senator Ward, for your time today. We know you have a busy, packed schedule, so taking time out for us, we really appreciate. And just want to wish everybody a great remainder to your day.
Well, thank you. I appreciated being here. I'll see you in Harrisburg, Tim.
Thank you.
Every day
Safe
I'm in
travels.
Harrisburg, I see you.
All right. Safe travels. Take care.
Bye-bye. You too. Bye-bye.